Hello and welcome everybody to another edition of the Midwest Concussion Clinic Monthly Lunch and Learn. Today we're going to talk about brain prep, the number one prep every athlete needs. The idea behind this webinar is to talk about how we prepare the brain for the upcoming sports season. You do everything that you can to prepare your body and make sure that you're doing everything you can to make sure your sports teams are ready and you're ready to compete at the highest level. But are you doing everything that you can to make sure that your brain is ready to compete at the highest level? My name is Matt. I am the owner of the Midwest Concussion Clinic. I do these virtual webinars every third Wednesday of the month, covering a different topic to make sure that you're staying as up to date as you can be on brain health and everything in the world of concussion. So the goal for today's lecture, like I talked about, is the first thing that we're going to talk about is how we prepare the brain. The first basic building blocks that we can do to prepare the brain to ensure that it's, number one, healthy enough to compete, but number two, optimized and set up to recover if a concussion does occur. The second thing that we're going to cover is everything along the lines of concussion preparation. Baseline testing, preventative equipment, preventative measures, my opinions on concussion prevention, and how we can do everything that we can to ensure that the brain is healthy moving forward. The third thing that we're going to cover is identifying common and uncommon concussion symptoms, what to look out for both physically, mentally, and emotionally, and what we need to prepare for just in case something does happen, especially if you're a parent or a coach or an athletic trainer trying to keep an eye out for concussions as they happen on the field of play. And the final thing that we're going to cover is the importance of the first 48 hours if an injury does happen. What to do, what not to do, everything that you can to set yourself up for a fast and efficient recovery. As always, I am available on all of our social medias at MW Concussion on Facebook, Twitter, Instagram, X, TikTok. The idea is my clinic is approachable. I will do everything I can to answer any questions that you have, to provide any guidance that I can on my end to ensure that everybody recovers efficiently and never really has to meet me. So what does preparing for the brain or brain prep really mean? The idea behind preparing the brain is we can do everything in our power to prevent concussions, like we're going to talk about later, but what can we do to ensure that the brain is healthy to compete? The basics that we've talked about, the basics that we're going to cover today is, number one, adequate sleep. We need to make sure that we're getting the amount of sleep required for our age group. It varies for every age group, it varies for every individual, but we need to prioritize sleep. The second thing that we're going to cover in the basics is proper nutrition, vitamins, and supplements. Proper nutrition, proper vitamin intake, proper supplement intake, supplement timing, and what we need to do when we need to take those vitamins in, what supplements are best on a daily basis versus what things that we can utilize moving forward. And the third thing that we're going to cover is proper hydration. Intake, timing, quality, quantity, what we need to do, what we don't need to do when it comes to hydration. So our three basics for brain health, the three basics that everybody should focus on, especially as an athlete preparing for your fall season: sleep, nutrition, supplements, and hydration. If you've ever heard any of my lectures, you've heard this phrase, or if you've worked with me in the past, you've heard me talk about sleep is the number one performance enhancing drug in the world. I say it every single patient that I work with. The number one thing that we need to do to get the brain to be as happy and healthy as possible is sleep. You want to be a better person? Sleep. You want to be smarter, funnier, better looking? Sleep. You want to be a better athlete, stay healthier in the athletic world, perform at a higher level? You need to sleep. We need to prioritize sleep on a regular basis. Sleep is not just something that you do once in a blue moon or something that you focus on only when you're in season. It is important to prioritize sleep throughout every aspect of our lives, every age group, every stage of our lives. It is important for brain health, for overall body health, to ensure that we are sleeping on a regular and consistent basis. So here's some general rules for sleep when it comes to preparing the brain for brain performance and preparing the brain for athletic performance. The goal for all of our athletes should be to sleep anywhere between 9 to 10 hours every single night. The goal is to get high quality sleep and sleep at nighttime. Okay, we want to prioritize high quality. You see it a lot on the slide. You hear me talk about it a lot. The goal is high quality and high quantity. But if we need to do anything, we need to prioritize getting high quality sleep. So the first thing that we need to focus on is getting 9 to 10 hours of sleep a night as an athlete. And I know you're looking at me saying, Matt, when am I supposed to sleep? I go to school all day. I go to practice at night. I come home and I have to do homework. I have to go to, I have a job. I have to go to a part-time job. I have to find some time to be a kid and socialize. When am I supposed to sleep? And the easy answer is, my job is to tell you how to sleep, not necessarily work on it with your schedule. I know it is challenging. I know it's hard. If anybody ever asks me, school should start at 10 a.m., right? I should push everything back. School should run from 10 a.m. to 4 p.m. All athletic events should be done by 7 p.m. You should be home doing homework by 8, in bed by 9, ready to roll and get your good night's sleep. But that's not realistic. There's a difference between the real world and the perfect world. Okay. In a perfect world, we get prioritizing 9 to 10 hours of sleep a night. Realistically, though, 9 to 10 hours of sleep can seem like a lot. If I've got to get up to leave for school at 6:30, I'm trying to get 9 hours of sleep or 10 hours of sleep a night. That means I've got to be in bed by 9, 8, 9 o'clock, 9, 10 o'clock. Like it's challenging. But if we're trying to be the best athlete that we can be, and we're trying to make sure that we're doing everything that we can for brain health, we need to prioritize trying to get 9 to 10 hours of sleep every single night. How do we get that sleep consistently? We need to maintain a constant and consistent sleep-wake routines. What do I mean by that? If you go to bed at 10 o'clock every single night, your high quality of sleep is more likely to occur. If I'm going to bed at 2 o'clock in the morning one night, 10 o'clock the next night, 1 a.m., 3 a.m., 5 o'clock, 6 p.m., if I'm varying my sleep schedule on a regular basis, there's 0% chance that I'm going to have high quality sleep consistently. Maintaining a constant sleep-wake cycle in season, out of season, weekday, weekend is important when it comes to navigating brain health and preparing your brain to compete at the highest level. Throughout this whole kind of talk on sleep, I've talked a little bit more about nighttime sleep and hitting on the goal of maintaining a high quality nighttime sleep. Napping is not a bad thing. Napping throughout the day is not necessarily something that should be avoided, but there are proper ways to nap. All napping should be 20 to 30 minutes or an hour and a half to 2 hours. We want to try to avoid doing anything between 30 to 60 minutes, and we want to try to avoid doing anything more than that 2 hour, 120 minute mark. Ideally, our napping occurs 20 to 30 minutes. A power nap, a caffeine nap. A caffeine nap, if you drink a cup of coffee or a glass of tea, something that has caffeine in it, generally it takes 30 minutes for the body to start to break down caffeine and for it to get into our system to wake us up. Drinking a cup of coffee and then trying to take a nap is a good way to idealize or try to internalize what a 30-minute nap should look like. The best, most effective nap when it comes to cognitive performance and physical performance is what's called a NASA nap. A NASA nap is 26 minutes from the time you fall asleep to the time you wake up. NASA has put a lot of research into sleeping and studying sleep to try to get us to Mars and try to improve quality of performance in their pilots. And they have found that a NASA nap is a 26-minute nap utilized to kind of increase the peak cognitive performance in their pilots. Now, if I'm napping throughout the day, I need to do everything that I can to keep all naps before 4 p.m. Why 4 p.m.? Any napping after 4 p.m. will try to trigger the brain into its sleep-wake routine for the evening. So essentially, if I'm taking a nap after 4 p.m., my body thinks I'm trying to go to bed really early for the day, and it's going to throw off your sleep-wake cycle at night. If I'm trying to do everything in my power, looking at kind of my collegiate athletes, my professional athletes, taking a nap in the middle part of your day will actually improve athletic performance during your competition time later. Now that we've covered the basics with sleep, let's get into food. Okay, when we talk about food and prioritizing nutrition for the brain, food is the best source of natural nutrition and natural vitamins and minerals that we can get in our body. But supplements are not necessarily a bad thing that should be avoided. Supplements are an easy way to get things into our diet, especially if we're on a special diet. If we're a vegan or a vegetarian, if we're doing a Mediterranean diet or a keto diet, supplementation is a way to get those extra vitamins and minerals into our system that we may not be getting with our normal regular diet. The challenge is we have to make sure that we're doing what's appropriate for us. These guidelines are general guidelines that are not specific to any individual person, but more specific to sport performance and athletic health and brain health versus what you may need individually. If you're allergic to any of the vitamins or supplements that I'm going to talk about, obviously do not take them. If you've got a special routine that you're on because you've worked with a dietitian or somebody like a primary care provider or somebody who's trained in your specific case, you need to continue to follow the recommendations set by your provider. If you're looking at doing everything you can to optimize brain health as a healthy athlete moving into your sports season, these are great general recommendations for you that you can implement every day. When we talk about nutrition, food is a fuel and it needs to be adequate for the body. If you're on a special diet during your competition season and you're in a caloric deficit, you're intaking less calories because you're trying to lose or control or maintain weight, you are setting yourself up for injury moving forward. Food is fuel. If the body does not have the fuel that it needs to perform or to compete, bad things are going to happen. Generally in this situation, bad things are significant increase in fatigue, decrease in athletic performance, and increased injury risk and rate. Food is fuel. It is not the enemy. We need to do everything that we can if you're on a special diet or trying to maintain a weight loss or weight control routine like a wrestler or somebody who's worried about gaining weight during their competition season. You need to make sure that you're getting the adequate calories, the adequate macros into your system to ensure that you have the fuel to perform at a high level. Vitamins are important to concussion prevention. I talked about it. Food is the best supplement for the best source of nutrients and vitamins that we can have. But when we're talking about vitamins, vitamins are important in concussion prevention. And I say prevention very cautiously, and you'll learn why in a little bit. You can't prevent concussions, but we can do everything we can to mitigate risk. Having a high level of vitamins in our system at the time that we get injured will actually decrease the metabolic cascade that occurs post-concussion and allow us to recover at a faster or more effective rate. The vitamins and supplements that I'm about to talk about should be taken regularly. It's not something that you should take once every now and then, once every other day. It's something that you should add into your morning routine every single day. Set them up in the bathroom, set them up in the kitchen. Once you wake up, you get up and get ready for work. You get up and get ready to go to school. You get ready for class. Taking your vitamins on a regular basis is the way to ensure that we have the high level of vitamins and minerals and supplements in our system that we need just in case something does occur to the brain, such as a concussion or an injury, and making sure that we have the high quality of vitamins and supplements in our system in case something does happen during athletic performance, making sure that we're ready for the sport participation that we're in, making sure we're ready for practices or games. When we talk about dietary recommendations, the whole goal for concussions is we want to limit the amount of inflammatory foods and increase the amount of inflammatory foods. Okay, so we want to limit the amount of the inflammatory foods that we're taking in, and we want to increase the amount of anti-inflammatory foods. We want to make sure that we're getting in foods to help control inflammation in the body. Inflammation is a natural process. Anytime that you perform an activity, anytime that you perform something that, you get injured, you roll an ankle, you hurt your knee, we want to make sure that we're kind of supporting the inflammatory process initially, but trying to control it in the long run, especially when it comes to concussion recovery. Those long-term concussion recovery, things that make symptoms increase as we move forward, is the neural inflammation that occurs post-concussion. We want to make sure that we're doing what we can to control the anti-inflammatory process and make sure that we're increasing anti-inflammatory foods while avoiding certain inflammatory foods such as processed foods, deep fried foods, artificial sugars, trans fats. We want to avoid those during our athletic performance. The supplement guide here on the screen is something that I talk about with every single one of the athletes that I work with, even after they've discharged from my clinic and are ready to return back to normal athletic participation. I broke it down into the basics, next level supplements, and then the ideal world. The basic supplements that every single athlete should take during their competition season are vitamins A, B12, C, and D. If you look at most of those, a general multivitamin is sufficient enough for most young adult athletes, high school, middle school, college age athletes. If you're taking a multivitamin on a regular basis, you need to make sure that at minimum it has vitamins A, B12, C, and D in them. If you're trying to do everything you can to take that next level, we want to make sure that we're taking in omega-3s, magnesium L-threonate, and BCAAs. BCAAs are an amino acid that their job is to help with energy production and cognitive and physical energy availability during your competition season. It acts similar to caffeine, but it's not a stimulant like caffeine is. It doesn't give you the same jittery performance or the same rapid burst of energy. It's looking at creating long-term energy. Omega-3s, they're good for inflammation control. They're good for brain health overall. And the magnesium can help you with your dietary health, help you with brain health, and help you actually sleep. If you're looking at doing everything that you can, we're taking in the basics. We've got a multivitamin, vitamins A, B12, C, and D. We've got our magnesium L-threonate, our omega-3s, and our BCAAs. Taking that next step and doing the ideal vitamin or supplement intake during concussion recovery would be adding 10 milligrams of creatine every morning. Now, if you're somebody who's like, well, wait a minute, back in my day, they told us creatine was bad for us. It was all going to kill everybody. It was going to make your kidneys shut down. The more research that's coming out with magnesium, the more research that's coming out on supplements, we're realizing that creatine is actually really good for us if we're doing it correctly. So if you're somebody who's a parent watching this or a coach watching this saying, hey, I don't know if I want to get into creatine with my kids. I don't know if I trust creatine yet. Creatine is very good for brain health. It is ideal when it comes to neural connections and helping foster those communication between neurons inside the brain. It's also good at helping repair tissue inside the body. So if we're looking at creatine, trying to do a 10 milligram of creatine a day routine during competition season, it's not detrimental to health. It's not bad for us as long as we're hydrating well with that creatine intake. So looking at vitamins and supplements, the ideal world, we're taking vitamins A, B12, C, D, omega-3s, magnesium, BCAAs, and creatine on a daily basis, especially during competition season. The reason being, it's good for brain health, it's good for brain performance, it's good for athletic performance. But, like I touched on earlier, if you sustain a concussion during your athletic performance, having the high level of each of these vitamins and supplements in your system within the first hour of you getting injured is actually proven to slow down the neurometabolic cascade that occurs post-concussion. It can make the damage from a molecular and biological level inside the brain less, and it can actually decrease the amount of recovery time that you have overall. Concussion recovery is individualized for everybody, but having these in our system is a good first step in case an injury does occur. The third step in the basics that we're going to talk about is hydration. Hydration has to be a priority every single day. It's not something that we should only prioritize during game days or during competition season. It is something that we should prioritize for every single person of every age group that we have moving forward. The hydration aspect post-concussion is important. It's important during brain health, and it's important to utilize moving forward in terms of just overall general brain health and overall health in general. Some basic hydration rules for everybody to follow. Every single process that your body does from a cellular level requires water. Every single one. From every molecule moving from inside and outside the cell, every communication or every production of hormone or anything that your body is carrying out to repair tissue damage, Every single cellular function in your body requires water. We are 60% water for a reason. Every single thing that we do requires water. If you do not have water, it's going to lead to decreased athletic performance. It's going to lead to increased injury rate and increased injury recovery times. How do I know I have enough adequate water in my system? A general rule for hydration should be an ounce per pound of body weight during competition season. I would venture to say an ounce and a half per pound of body weight would be more sufficient. But if you're aiming to get an ounce per pound of body weight of water intake per day, you will be great in terms of hydration levels for your competition season. Hydration works 24 hours in advance. The water that you're taking in now helps guide you for the activities and the performance that you're going to work with tomorrow. Chugging a bunch of water right before going out on your competition is not going to benefit you in the long run. The goal should be that you're trying to keep a consistent water intake every day. You hear me keep saying water intake, water intake, water intake. Caffeine is a dehydrator. Adding caffeine into our routine will dehydrate you, meaning you need to increase our water intake. Using additives in our water like Liquid IV, Pedialyte, Pediasure, Smart Waters, Gatorade, Powerade, adding electrolytes into our normal water intake helps get more benefit for the amount of water ounces that we're drinking, but water is still the number one hydrator that we should be working on and prioritizing every day. Caffeine is not a bad thing necessarily if done correctly. Anything in moderation is okay, but if we're looking at trying to optimize performance athletically and making sure that the brain's healthy enough to perform, we should focus on taking in water every single day. Okay, now that we've covered what we need to do for the basics, now that we've covered brain health, covered kind of prepping and what prioritizing sleep, hydration, nutrition, and supplements looks like, we need to start talking about what we're doing to prepare your brain just in case an injury occurs during your competition season. So when we talk about brain prep, I'm going to talk about brain baseline testing, baseline concussion testing through your school or your sport organization, and then I'm going to talk about the idea of prevention. I hate the concept of concussion prevention because as of right now, there is nothing that we can do to prevent concussions or prevent injuries. Injuries are going to occur, concussions are going to happen. We just need to do everything that we can to mitigate the risk of concussions, to do everything that we can to reduce the risk of injury rate during athletic performance. Baseline testing is a hotbed topic in the sports medicine world, particularly in the athletic training world. It is very divisive. You have two camps: really beneficial, not beneficial at all, not worth my time, money, and investment. Baseline testing is helpful, but it's not always beneficial. What does that mean? Baseline testing being helpful. It's a good tool. It's a good tool to have in my toolbox to say that I'm doing everything that I can to, just in case an injury occurs, or doing everything that I can to make sure that if an injury occurs, I know what normal and I know what regular or my baseline looks like. But it may not always be beneficial. In my concussion clinic, I can tell you the amount of times that I've had a baseline test, I can probably count on two hands. I've seen over 1,300 patients at this point, and I very rarely get any baseline testing data sent into my clinic. Does that mean that I can't make an informed decision, or I can't make a diagnosis or a return to play, decision? No. It just means that I have to go more on objective testing and subjective responses versus having that objective data at my fingertips. What happens if you don't have a baseline test? Is it the end of the world? No, it's not the end of the world. It's not the end all be all. It's not a dangerous thing to not have a baseline test for your concussion protocol or your school or sports organization. But it is helpful to have that knowledge in case an injury does occur, especially for the athletic trainers trying to make a decision on concussion diagnosis in an acute setting. But it doesn't necessarily end with having a baseline test. It doesn't make a decision, okay, you performed as good on this as you did on your baseline. It doesn't mean that you're necessarily healthy enough to return to sports without needing further evaluation. For athletic trainers, for coaches, it's a good tool to have in your toolbox, but it is not the end all be all and not something that you need to prioritize necessarily during your concussion protocol, setting up your concussion protocols. So here are the basic rules for baseline testing. Baseline testing is only as effective as the effort and the timing that the athlete puts into taking the test. If you've ever administered a baseline test or ever gone through a baseline test, it's usually a bunch of people sitting in a gym or at a computer lab all at the same time. And it's usually first thing in the morning on the first day of practice for the fall saying, hey, I need you to figure out how you're going to perform at your highest level. And you're still trying to figure out what day of the week it is because it's the middle of your summer. Baseline testing is designed for an athlete to put in 100% effort, both cognitively and physically, at the time of administering that baseline. And then it needs to be reviewed by a trained healthcare provider to ensure that it's a proper baseline and it's not been flagged for some various reason, depending on the type of test that we're administering. So the baseline is only as good as the amount of effort and when it was taken. Baseline tests need to be repeated at minimum every 2 years, depending on your manufacturer of the test. The clinical data goes down outside of 2 years. If you think about the type of person you were, both athletically, emotionally, physically, relationship-wise, job-wise, school-wise, where you were 2 years ago, you're a completely different person than you are today. Having a baseline retested every 2 years is important when we look at comparing baseline testing to post-injury data. If I have an injury that occurs and I've been cleared to return back to sport, that final step of that clearance to return back to sport should be to re-administer a baseline, because you now have a new baseline reading or baseline level post-injury. So if you're not repeating the baseline at minimum every 2 years and at ideally or at recommendation every injury that happens, those baseline tests become less effective. And like I touched on, it's one piece of the concussion diagnostic or clearance protocols. It's not the end-all be-all. You should not be using a concussion test, a baseline, comparing it to a post-injury test saying, hey, these are the same, you're now cleared to go back to play. That's not what they're designed to do. They are a tool that you're able to utilize in your toolbox when making those informed decisions clinically. Concussion prevention is impossible, but risk reduction is something that we should all be focusing on. As the owner of a concussion clinic, my goal and my hope is I never have to meet anybody. It's a very interesting approach to concussion prevention, a very interesting approach to a business model, but I never want to meet or have to work with anybody. I want everybody to succeed, everybody to compete at a high level, and never have to be injured or never sustain a concussion. I don't wish anybody to get injured, but my clinic is here to help you if you do get hurt. So I spend a lot of time talking about concussion prevention and concussion reduction. I do not like to talk about calling it prevention because, in my opinion, you can't prevent it. So from here out moving forward, I will only be talking about concussion risk reduction or concussion reduction. There are different concussion equipment devices that you can find on the internet. You can go to Amazon, you can order these, you can order them direct from the website. And the idea is they are designed to reduce and prevent concussions. If you're listening and you're paying attention, we can't prevent concussions. So all of these objects are designed to reduce the risk for concussions. I'm going to talk about the four major ones because they're the ones that most of the media gets into play. I do not get any financial support for these, any kickbacks. This is my informed decision based on the independent research that I work with and the research that I've compared over the years. The first one we're going to talk about is the one that's being utilized in the NFL and football quite a bit right now, and it's called the Guardian Cap. It's the padded helmet covering that you see on the NFL training camps. You see it now in some of the NFL games. A lot of colleges are using them. A lot of high schools are using them. But it's a pad designed to go on the outside of the helmet that helps reduce the impact force sustained when somebody hits head-to-head with someone. The idea behind the Guardian Cap is great. The challenge is that pad, or that reduction in the force, does not decrease the shearing force that occurs inside the brain when we get a concussion. Concussions generally are not the brain smacking the edges of the skull or the different areas of the skull, generating a bruise to the area, but more of a shearing force that occurs inside the brain tissue itself. The Guardian Cap's design by reducing the impact force is great, but it doesn't reduce the amount of shearing that occurs inside the brain. if we're looking at trying to do everything we can to optimize and reduce the risk for concussions, and you're trying to make sure that you're preventing as much injury risk as we can, the Guardian Cap is a decent option, but it is not something that's going to completely prevent anything. The second thing that we're going to cover is the Q Collar. The Q Collar is the only FDA-approved concussion wearable device that has been proven to reduce the risk for concussions. The Q Collar is a device that goes around the neck and puts compression on the jugular veins to back up blood flow into the brain, essentially causing an increase in the blood volume of that blood-brain barrier. The idea is increased blood flow and increased blood-brain barrier reduces the amount of movement that occurs inside the brain cavity or inside the skull. What happens is it does not reduce the shearing force that occurs inside the tissues themselves. So the Q Collar is designed to be worn by athletes the entirety of their competition season. If you choose to purchase the Q Collar, do not take it on and off and move it or adjust it once it's been put on. The idea is you're supposed to put it on before your competition and wear it throughout the entirety of your competition. The Q Collar is a good option. The challenge is it has to make sure that it fits properly, and it's something that, especially in the high school world, you will most likely have to buy a new one every season. The third thing that have been used and kind of marketed as concussion preventions are different mouth guards. Mouth guards forever, if you start looking at ways we've changed and the research that's changed on concussion prevention, mouth guards have been thrown into the conversation a lot, because if I'm reducing the teeth chatter that occurs when I hit somebody or when somebody hits me, I'm reducing the amount of force that's being transitioned or pushed into the brain. Mouth guards are designed for dental fractures and preventing or reducing the risk of dental injuries. Their effect on concussions is minimal or marginal at best, but if we're looking at doing everything that we can to reduce concussion risk, making sure that you're wearing a properly fitted mouthpiece can help reduce the amount of force experienced inside the brain. Again, it doesn't do anything to reduce the shearing force that occurs inside the brain tissue, but we're reducing the amount of force overall. The last concussion wearable that most people know about or have heard about or seen marketed, especially if you are a contact sport athlete, is a concussion headband. It's a padded headband that goes around the temples, around the base of the head, and it's designed to work similar to a helmet for non-contact sports like your soccers, your volleyballs, your basketballs. And I use the phrase non-contact loosely. Anybody who talks about any sport being non-contact was not very good. I've watched a lot of soccer games, a lot of basketball games, a lot of volleyball games. There's a lot of contact that goes into those non-contact sports. So the idea behind the concussion headband is, again, we're reducing the amount of risk or the amount of force that's generated when the head hits the ground or when a soccer ball hits the head or when somebody goes head to head. Reducing the amount of force on the skull is great, but it doesn't do anything to reduce the risk or reduce the amount of shearing force that occurs inside the brain. All four of those products on the screen right there are great products to use if you're trying to do every single thing in your power to reduce concussion risk. But be careful, they are not designed for concussion prevention. When we look at the research that's been done on all of them, we need to make sure that we're looking at double-blind studies and looking at who's performing the research and who's funding the research. All of these options are designed to make money. Okay, keep in mind, they are businesses first. Their business is reducing and preventing concussions, but at the same time, they are a business. All four of these products are great products, and especially if you're trying to do everything in your power to reduce the risk of concussion, it's a great thing to have, but it's not going to completely prevent concussions. There's nothing that we can do to completely prevent concussions overall. The one thing that gets thrown around every single cycle that we have when it comes to concussion risk reduction, concussion prevention, concussion injury reduction, or neck injury reduction is the idea behind functional neck strength. Functional neck strength has been in every single theory, every study moving forward. It's the one thing that we can all kind of hang our hats on as concussion researchers, saying what we need to do moving forward is we need to ensure that functional neck strength is something that we prioritize during our strength routines. So A free, cheap option that every single athlete can start doing today to improve functional neck strength is what's called the Verstigi tuck and roll. The Verstigi tuck and roll is a 3-step rolling exercise that can be used in any strength and conditioning program, any pre-activity warm-up, any dynamic warm-up, and it consists on sitting on your butt with your feet flat on the ground, your chin tucked down to your chest, hugging your knees. Your goal is to roll backwards so your shoulder blades contact the ground, keeping your chin tucked, keeping your knees in, and then rolling back up into a seated position while keeping your neck in a consistent routine or a consistent position. Number one, it teaches us how to fall down. When we fall down, the first thing that we should do when we fall is tuck our chin down to our chest and bring our hands forward so we're not putting our hands back, we're not falling and slamming our head back on the ground, causing an increased injury or a concussion increased risk by hitting our head on the ground. The second thing that it does is it increases that functional strength. We have the ability to keep our head upright. We have the ability to control the movement, the rotational forces that are occurring during a fall or an unplanned hit to the head or body. The goal for the Verstigi tuck and roll exercise is for you to do 30-second intervals where you're rolling and tucking your chin back, rolling up and rolling back, rolling up consistently for 30 seconds with your chin tucked to straight ahead, 30 seconds with your chin tucked looking to your right, and 30 seconds with your chin tucked looking to your left. If you're looking at trying to implement or trying to add functional neck strengthening exercise, this requires no equipment. This is very low athleticism level. I can do this, and I'm not the best athlete in the world. I'm definitely not in shape. So I can sit here and say that this is an exercise that anybody with any athletic level can implement into their daily routine and in order to improve functional neck strength and decrease concussion risk. Functional neck strengthening equipment can be a major asset to any strength and conditioning program. For those coaches and athletic trainers that may be watching or listening, following along, adding a simple functional neck strengthening equipment to your routine or into your gym can significantly increase the amount of functional strength, especially rotational strength, and decrease concussion risk. These are my 3 favorites. The first one that I want to talk about is the Topspin 360. It's a new concussion tool that's been on the market for the last couple of years. The research that's coming out has been really good in terms of building rotational neck strength, which is where a lot of that concussion injury occurs. It's not necessarily the forward and backwards or the right, the left, the straight line linear forces that cause problems. It's the rotational force that occurs when somebody hits their head or when somebody falls or gets hit in the body that causes the issues. The idea behind the Topspin 360 is it's a wearable helmet that you put on with a weight, and your goal is to spin the weight around. And we can go clockwise and counterclockwise. There's a lot of injury reduction and concussion reduction research that's being done. One of the ones that I remember seeing that's really caught my eye is last year, the significant reduction in concussions that the Detroit Lions had. And they were one of the first NFL teams to completely implement it within their sports medicine department. It's an incredible tool that we can utilize to help increase functional neck strength. The second one here in the middle is what's called the Iron Neck. It is a wearable designed for you to utilize inside a gym setting. It's got a pulley and cable system that can allow you to do straight line exercises, flexion extension, right and left lateral bending. It's also got a component that you can do rotational strengthening, and it's got varying levels of resistance that you can utilize depending on your functional neck strength routines, whether you're a beginner, middle school age, high school age, college age, professional athlete, somebody who just wants to, is an everyday athlete like a pickleball player and doesn't want to run the risk of getting a concussion. That functional neck strength is something that you can utilize in any given strength and conditioning program, no matter how high tech or low tech your routines are. The third one is Next Level. It is a tool or a piece of equipment that you sit on the ground. It's got varying resistance levels that you can utilize with the different color bands. You lay down on the ground, put your head on the machine, and it allows you to do rotational strengthening. It's a low space requirement. It's a relatively affordable piece of equipment. If you're a PT, somebody who works in athletic training, and you want to have, if you're looking at bang for your buck type equipment across all athletes, employing a Next Level into your clinic is easy setup. Athletes can set it up. It's very easy to use and maintain, very little clinical footprint. And it's one of those tools that it's a good bang for your buck model. Again, with these 3 pieces of equipment, with our 4 pieces of concussion prevention tools and techniques, I don't get paid by any of these companies. I don't. Nobody sends me anything and says, "Hey, I want you to talk about my product." Doing my, running my clinic and doing my research that I've done over the years, my job is to inform patients on the best equipment out there. And in my opinion, these are the top 3 that I bring up with my patients and my clinicians that I'm trying to implement concussion risk reduction and concussion risk techniques or protocols into their clinic. Again, I don't get paid by any of these. These are just the great things that I've done my independent research on and the things that I would recommend for anybody in terms of building functional and neck strength. So now that we've done everything that we can to talk about, concussion risk reduction, baseline testing, the basics in trying to make sure that the brain's healthy to perform, now we want to talk about that bad situation or that unfortunate situation in case a concussion does occur, what you should be looking out for. So when we look at concussion symptoms, they will present differently for every individual. Concussions are very unique per person. What looks different for you or what occurred during your concussion may not occur during somebody else's. Concussion symptoms will present differently for everybody. Now, we cannot compare concussions, past concussions to current concussions. So you need to be careful and you need to know what all symptoms to look out for in case you're trying to identify concussions, especially as a parent looking out for an athlete or as an athlete trying to figure out what's going on inside your head. These are the symptoms that present early on generally in our concussion. Once a concussion recurs, the common things that most people will feel immediately within a couple minutes post-concussion. On the left there, red flag symptoms. These are the symptoms that if they do occur, you need to be transported to the emergency room immediately for further evaluation. The likelihood that these symptoms occur is low, but these would be considered life-threatening situations or life-threatening symptoms until proven otherwise. So if you have anybody that loses consciousness, has an altered mental status, has uncontrolled vomiting, and what I mean by that is it's not just a one-off, I got hit and I threw up. Generally with vomiting, if it happens consistently for greater than an hour immediately post-concussion, it's considered a red flag. Any rapid deteriorations, whether it's altered mental status, a significant increase in symptoms, a rapid deterioration in balance or their speech patterns, any rapid deterioration is a red flag that needs to be evaluated immediately. Any seizures, slurred speech, weakness and numbness into the upper extremities, lower extremities, or facial features, difficulty controlling the face, and any severe neck pain. Again, those are red flag symptoms that need to be transported to the emergency room for further evaluation quickly. Whether by EMS or by car, you need to get evaluated quickly. Again, the likelihood that the red flag symptoms occur is very low, but it's something that you need to be watching out for, especially as a parent, coach, or athletic trainer, to make sure that we're doing everything that we can to protect athlete brain health moving forward. Common physical symptoms that present right away: headaches, dizziness, neck pain. Generally, those are the 3 that most athletes will report that occur right after the injury themselves. Most athletes, I will tell you, working in sidelines, working in sports medicine, you have the 2 different caliber athletes. The first athlete is, once something changes, I'm going to tell you right away, whether it's I stubbed my toe, I rolled my ankle, or I hit my head. They're going to tell you something's different, something's wrong, and I need to figure out what it is. Or you have those athletes that nothing is ever wrong. Nothing changes, nothing's different, nothing that I'm going to tell you about is going on. So generally speaking, if we have a concussive event, a rapid hit to the body, a rapid jolting to the head or neck, a rapid movement inside the head, something that would cause a concussion itself, they're going to present physically right away with headaches, dizziness, some neck pain and tension, blurred or double vision, generalized ataxia, which is loss of balance, loss of coordination, stumbling, vomiting, or nausea. Those are something commonly that people will report. If I'm an athletic trainer, I'm a coach, I'm a parent watching my son go through or daughter go through a concussive event, a collision, diving, hitting their head on the floor, hitting a soccer ball, something that you can look out for is what's called the shake. The shake is sudden head shake after a kinematic event, SHAAKE. It's a symptom it's a concussion sign that's been identified by the Concussion Legacy Foundation to mean that a concussion has occurred more often than not. And it's very simple. We have that concussive event. The athlete gets up. They shake the cobwebs out. They're trying to clear their mental thought. They're trying to clear their vision. They get up, they shake their head. That has been scientifically proven through research to indicate that a concussion has occurred more often than not, and they should be evaluated. If you look at every movie, if you look at every TV show, professional wrestling, we've used the head shake as a way of that showing when somebody's hit their head and that they need to take a couple seconds to get the cobwebs straight and to make sure that they're okay. Why it took us this long to figure out what that's a concussion symptom or a sign, and it's something that we should look out for, is bizarre. But now that we know that it's out there, it's something that from the sidelines you can watch and you can look for. If I have a daughter that dives and hits her head on the ground, and the first thing she does is shake her head after she hits her head, I am going to do everything in my power to ensure that we have a concussion evaluation take place. Common cognitive symptoms that occur right away: confusion, disorientation, difficulty with speech, not remembering how to say words, not remembering what words to, that we're trying to say. A lot of times when I'm talking to my athletes, especially in the acute setting, hey, do you know where you're at? Do you know who's playing? Do you know what time it is? Do you know what the game is? They may not be able to give you the answer to those questions right away. Give them a couple minutes and it generally will come back to them. But if you're doing an evaluation, especially on the sidelines, talking to them right after the game, there may be some confusion that occurs right away. And they may have some difficulty answering questions, like concentrating on you, attention difficulties, concentration difficulties that occur right away. Other things to look out for in common symptoms that occur early are emotional changes, rapid mood swings. I'm laughing for no reason. I am crying for no reason. Generally, somebody that's a laid-back person is aggressive, has anger issues, has a temper. Crying for somebody who's never cried before. Generally speaking, somebody standing there and they have that single tear that rolls down their eye. That's an emotional response that occurs post-concussion that needs to be evaluated. Concussion symptoms may not present immediately, which is a challenge when it comes to concussion diagnosis. Concussion symptoms may not occur right away after the hit. Adrenaline's high. You have an athlete that's involved in a sporting event. They're focused on the sport. They're focused on the play. They're focused on what's going on the field or on the court. Concussion symptoms may not present right away. So if you're an athletic trainer or a coach and you're getting mad at an athlete because you feel like they're lying to you, they may not know how they feel right away. Their concussion symptoms may not have presented right away. Cut them some slack. If you're an athlete, you need to be honest with how you're feeling. You've got 2 knees, 2 ankles, 2 shoulders, 2 elbows, 2 toes. You can get new heart and lungs. You cannot get a new brain. You need to make sure that you're protecting the brain that you're given and doing everything in your power not to have any increased risk in second impact syndrome or any increased risk in brain damage by competing with a concussion. Some of the lesser known symptoms that people may experience, that especially if you're a parent and you're concerned, things that you can look out for and ask questions and leading questions with your athlete to ensure that they're healthy enough after a competition or after a hit to the head that you observed. Excessive fatigue, sleep and fatigue issues, daytime sleepiness, sleeping more than normal, sleeping less than normal, changes to physical fatigue, changes to like watching them walk and they feel like, they're out of breath going up the stairs, feeling generally out of shape. Those are some things that you can observe as a loved one, a family member, a support system, somebody that you're watching that occur, you can look out for in terms of changes to their normal routines. Changes to their dietary habits or dietary patterns, loss of appetite, increased nausea following eating, vomiting that occurs randomly, especially after eating, changes in eating behaviors. I have an athlete who barely eats during season. Now they're eating me out of house and home. Anything that's wildly outside of what would be considered their normal is something that should be a cause for concern and could potentially trigger in a concussion evaluation. The third lesser known category that I broke it down was emotional changes. Personality changes, lack of emotion, right? Generally, when I see athletes that are talking about personality changes and they're not sure whether concussions happened, they talk about lack of emotion. I'm not happy, I'm not sad, I'm not energetic, I'm not my kind of happy-go-lucky self or my low stress, low worry self. I kind of just feel like I'm meh all the time. I feel like I'm stuck in the mud. I just don't feel much of anything. That's something that needs to be evaluated for a concussion because concussions present very similarly to depression. If we look at the basic definitions of a concussion, it's a brain going slower than it wants to go with a hormone imbalance. If we look at the basic definition of what depression is, it's a brain going slower than it wants to go with a hormone imbalance. They are the exact same. It's very common for concussions to present similarly to depression, and it's very common for athletes to have post-concussive depression. they should be evaluated if they're presenting with any of those changes in emotional response or any significant changes to the emotions overall. The last thing I want to take away with concussion identification is, when in doubt, sit them out. As an athletic trainer, if you're not sure somebody suffered a concussion, but you know they went through a concussive event, there is nothing that is going to hurt you or harm you in any way by being cautious. What I usually would do if a situation where I was unsure, especially in an acute setting, because it's very challenging to diagnose a concussion early on, right? They're the easy ones. They lost consciousness. They don't know who they are. They don't know where they are. The emergency red flags, those are easy. But if I get an athlete that went head to head and they come over, they're like, yeah, I was dizzy for a couple seconds and I'm fine now. I had a headache, but it's gone now. Like, those are the challenging ones to diagnose, because headaches and dizziness are also some common symptoms of dehydration. If there's ever a doubt, remember the phrase, when in doubt, sit them out. There is no harm ever done by an athlete being held out of a game and losing a game versus returning them to play and then potentially suffering a life-threatening or life-ending injury. So if you're not sure, sit them out until they can get evaluated by somebody who's trained specifically in concussion evaluation, like a physician or an MD or a DO that's specifically trained in concussion evaluation and management. When in doubt, sit them out. The last thing that I want to cover when it comes to concussion, this webinar, preparing the brain for the fall sports season, is the importance of the first 48 hours. We've done everything that we can to prepare the brain for competition. We've done everything that we can to reduce concussion risk. We know what to look out for, but what do we do if a concussion has occurred? The first 48 hours are the most important part of concussion recovery. So what are the do's and don'ts of that first 48 hours? The first 48 hours will make or break your concussion recovery. If we do everything in our power to abide by these rules through the first 48 hours, we are setting our concussion recovery up in a much better and much more optimized position than we are if we ignore the first 48 hours. One of the challenges with that can be some people don't know they've had a concussion within the first 48 hours. So when I talk about preparing for the first 48 hours, if there's ever a doubt, or if you're unsure that there's something that has occurred, you don't know whether you have a concussion or not, you should always err on the side of caution and treat those first 48 hours like you would if you had a concussion. So the do's and don'ts post-concussion for the first 48 hours. The do's. We want to prioritize sleep. We talked about it early. If a concussion occurs, what we need to do to optimize the brain for athletic performance are the same things that we need to do from a sleep situation or a sleep standpoint if an injury does occur. We want to try to sleep as much as possible. There was a new research study that actually talks about daytime sleeping and increasing concussion symptoms and decreasing recovery. But when it comes to the first 48 hours, sleep is when the brain repairs itself. So outside the first 3 hours post-injury, we want to encourage our athlete, we want to encourage our son or daughter, we want to encourage that patient to sleep as much as possible. But if they're not sleeping at night, we need to control their daytime sleeping. The second thing that we want to do is we want to avoid stress. Physical, mental, emotional, and cognitive stress as much as we can. We want to control the amount of stress that we're going through. So we need to basically isolate ourselves for the first 48 hours. Isolating outside of 48 hours is bad for us, but we need to do everything that we can to control the amount of stress that we have coming in inside that first 48 hours. The third thing that we need to do in that first 48 hours, ideally, is get evaluated by a concussion literate provider. One of the goals for concussion evaluation is we need to evaluate you as quick as possible so we know what we're working with. We know where the deficits are, and we can actually implement that routine specific to you, tailored to your individual situation, individual concussion, as quickly as possible. These 48 hours are generalizations, but if I can get somebody evaluated and on a treatment plan specifically to you, including which vitamins and supplements to take, which exercises to do, which things to avoid, making sure that we're getting that medical attention in by a concussion, or that medical evaluation by a concussion literate provider, is key. And then the fourth thing is we need to focus on the basics. We need to focus on making sure that we are getting everything that we can to resuming our supplements if we haven't, if we didn't take them, starting in that daily supplement routine of your vitamins, your minerals, vitamin A, B12, C, D, omega-3s, and magnesium. We want to make sure that we're prioritizing our hydration, and we want to make sure that we're intaking a high anti-inflammatory diet overall. So Again, the 48-hour post-concussion do's. Prioritize sleep, avoid stress, seek medical evaluation by a concussion-literate provider, and resume the basics if we haven't started them, or continue to do the basics in sleep, hydration, and nutrition, and vitamin supplement routine to kind of optimize our concussion recovery. Laying low is the easiest way to describe the first 48 hours. We want to lay low. We want to limit the amount of physical stress, the physical evaluation, the physical and cognitive exertion that we're doing, and we want to just kind of lay low. The things to avoid. We don't want to return to sports within the first 48 hours. Even if you feel like a concussion has not occurred, we want to make sure that we're getting a proper, thorough evaluation, and generally speaking, that's not going to occur within the first 48 hours. But if you have a concussive event and you're trying to rule out concussions, you've done everything that you can, been told that you don't have a concussion and you've been cleared to resume activity, great. But if you have not been cleared to resume activity, even if you're unsure, you don't have an athletic trainer or a provider that you can go to, do not return to sports participation within that first 48 hours. We don't want to use electronics in that first 48 hours. The entire world is done on a screen. Your phones, your computers, your TVs, your laptops, your tablets, everything is a screen. Avoiding screen time during that first 48 hours reduces the amount of physical stress, eye strain, eye fatigue, cognitive stress. It reduces the amount of stress that we are taking in during that first 48 hours and can set you up for a better recovery in the long run. The third thing that we want to avoid during that first 48 hours is returning to school. There's a lot of research that tells us that if we return to school within the first 48 hours, we are going to make symptoms worse. We are going to increase the amount of symptoms that you're experiencing, the intensity, the kind of symptom effect overall is going to go up. So if you're somebody who has suffered a concussion and you're like, hey, man, I got to be at school. I got to be there. I got to go. We should have academic accommodations at the bare minimum that allow us modified attendance, dark rooms that we can sit in if symptoms go up, and the ability to go home if symptoms do occur. I have a concussion professional development course that I present to schools titled Concussions in Academics, and the whole goal is to educate the administration, the school, the educators, the school counselors, everybody on the idea of implementing return to learn strategies and how we can help assist a concussion, a patient who suffered a concussion or an athlete who suffered a concussion during their school day. If you have to return to school in that first 48 hours, at minimum, you should have academic accommodations in place. But I'm here to tell you that we should really avoid school for that first 48 hours. Same goes with work. We should avoid that stress for the first 48 hours post-concussion in order to optimize brain recovery moving forward. And the last thing that I want to cover, the don'ts when it comes to the first 48 hours, is don't panic. There's a lot of varying responses or varying opinions when it comes to concussions. You have the two major camps. They're no big deal or you're dying. I am here to tell you that it's in between. There is a lot on the more severe side, the more dangerous side, the more we should be nervous side. But I am here to tell you, don't panic. Concussion recovery is possible, especially if you're a young, healthy athlete. Otherwise, your recovery will go well. Don't panic and do everything that we can to set you up for an optimized recovery in that first 48 hours. The last thing we'll talk about with the first 48 hours is those do's and don'ts are not a vacuum. If you do one thing, but let's say I'm on my phone or on my computer, am I completely wasting my time trying to do everything else? No. We want to do our best. Doing our best is the only thing that we can ask for. I work in the medical world. I work in the perfect world. I live in the real world. If I tell an athlete to limit phone time, screen time, the first thing they're going to do when I get off the screen or when I walk away is they're going to not utilize those screens. They're not going to listen. They're not going to be out, and they're not going to do things on a regular basis. My coworkers decided to come into the video today, so I apologize for that. Okay, the last thing that I want to kind of wrap things up with here on our concussion recovery and this whole presentation on preparing the brain for the fall sports season is I hope that you understand that we need to prioritize the basics. We need to focus on getting good sleep at night, a goal of getting 9 to 10 hours, 9 to 11 hours of sleep at night as an athlete. We need to make sure that we're drinking water. taking our vitamins on a regular basis, vitamins A, B12, C, D, omega-3s, magnesium, BCAAs, and creatine on a regular basis. We need to make sure that there is no perfect way to prevent concussions, but there are different products that we can utilize to reduce the risk post-concussion. I covered the 4 major ones back earlier in the presentation. Go back and check them out if you're not sure what they are. If you have any questions on the specific ones in which I recommend, feel free to reach out, DM me, send me a message, ask me that question. I will give a much more detailed opinion with each one of those products, or if you have a different product in mind, I'd love to look at it. I love to research it and try to figure out what it is and how it benefits us in reducing concussion risk. Baseline concussion testing, it's a great tool to have in our toolbox. If you use it, great. If you have a sports program that does not utilize it, it's not the end of the world. The third thing that we covered is I want you to make sure that you understand concussion symptoms present differently with everybody. Common symptoms are going to be a mix of physical, mental, and emotional symptoms that you can look out for. The big ones are headaches, dizziness, altered mental status, changes in mental presentation, confusion, disorientation, and then emotional changes or changes to the emotional regulation or rapid changes to mood swings. And the final thing is, if a concussion does happen, lay low for the first 48 hours, prioritize those vitamins, supplements, hydration, and nutrition, prioritize getting nighttime sleep. Getting an evaluation by a concussion trained provider in the first 48 hours is critical, and don't panic. Things will get better throughout your concussion recovery. If you've made it to the end, thank you for following along. Again, my name is Matt. I am the owner of the Midwest Concussion Clinic. Every third Wednesday of the month at noon Eastern here on YouTube or TikTok, we utilize what I call the MCC Lunch and Learn, where I cover a different topic on brain health, concussion recovery, athletic performance, doing everything that we can to ensure that we never have to meet in a professional setting. Be a friend, tell a friend. If you like the webinar, share it with somebody. As always, you can find us over on all of our social medias. We are at MW Concussion on Twitter, X, Facebook, Instagram, TikTok. Here on YouTube, we're at Midwest Concussion Clinic or at MW Concussion. If you have any questions specific to you, feel free to reach out. I would love to talk to you. Love to answer any questions that I can to help make sure that you're doing everything that you can to reduce concussion risk. And as always, thank you for tuning in. Thank you for listening. Thanks for sharing. I'm here if you need anything. Take care.